Welcome to Healthcare Ops Wave. It's not only an acronym for how, but also healthcare operations and waves are actually very similar. Both are steady, run in cycles, and have the odd storm in between. I'm Frederik Mueller. I'm the co-founder and CEO of Third Way Health, and we'll bring you the stories that shed an inside look on the humans behind healthcare operations.
Welcome to another episode of the Healthcare Ops Wave. And I'm super excited to have Ina Plum with us. Ina, thank you. Long time in the making.
Long time. You could say 20 years in the making. Excited to be
20 years in the making. Yes. So, for everyone that doesn't know what we're talking about, Ina and I went to high school together. Shout out to the George School in good old Newtown, Pennsylvania. And
Go Kriegers.
yes, go. And I think it's fair to say I didn't know that we would end up in this point virtually today. So lo and behold, we both work in healthcare operations. And I think what I am super excited about is that, we use this show to shine a light on healthcare operators. And we oftentimes talk to executives in sort of your traditional medical practice setting. And you've been an operator in 8 traditional healthcare delivery settings, and I'm sure that has created its own fair set of interesting stories that we can hopefully hear today.
Absolutely. Absolutely. It's been a fun journey.
Well, all right, so let's start off small. How did you get started in healthcare to begin with? And can you tell us a little about your journey and then, weave into that what you're doing today?
Sure thing. I did not intend to go into healthcare in any capacity, actually, originally. My husband was the one who was supposed to, he was pre-med, was supposed to become a doctor, actually also a George School grad. Shout out again to George School. But I'd started my career in finance and just kept inching closer and closer towards operations as I realized I actually love to build things from scratch, and that's the most fun thing for me to do, most rewarding. I jumped into Blue Apron fairly early on, actually, post finance. My immigrant family thought I was totally nuts to leave a well paying career in finance and jump over to this little known startup called Blue Apron. But it was the ride of a lifetime. I got to build their supply chain org and be with them through their IPO. And that's where I realized, like, this is it. I've got the bug. I want to build stuff. I want to build companies. And early on, I wasn't, I was a little bit agnostic on the industry, but I got pulled into Redesign Health as one of the early founding partners. And the draw was, hey, healthcare is big and complicated, and we want your investor brain to help us figure out good companies to invest in and build, and we want your operator brain to then go and turn them into reality because it was an incubator. And that just seemed like a perfect and incredible opportunity. And so that was where I really started to learn more and more about the space and fell in love with it, because you get to make a difference in people's lives every day. Where else? I mean, there are certain other industries, but this is a pretty amazing one. Even though it's a tough one. It's hard to make businesses work in health, but that's part of what makes it really fun.
And so sorry to interrupt, but I think it's fascinating, and because I think actually a fair amount of people sort of end up finding themselves in healthcare, not intentionally setting out that, at the beginning of their career to be in healthcare. And I would include myself in that. Was there a moment when you sort of like a falling in love moment with healthcare, or a moment where you're like, gosh, I'm really in this industry?
It's a good question. I think it was when I first got to do visits in our patients' homes with MedArrive. Because up until then, it was a fascinating kind of intellectual puzzle for me. But something about going into patients' homes and seeing our providers at the time, we were working with paramedics in patients' homes at MedArrive, and just seeing the difference they were making in people's lives, and the deep, deep connection our paramedics had with the patients, and the difference of post MedArrive and pre MedArrive. It was like, wow, like I didn't set out to do this, but I'm making a difference in people's lives. How could I do anything else for the rest of my life? So that was pretty cool.
That's awesome. That is the beautiful thing. The impact is real of what we do. So, but I interrupted you because you were saying you took the leap of faith with redesign, and then how did that turn out?
It was such an incredible journey. I got to build a bunch of companies with Redesign and really learn what it takes. But because, building in healthcare is hard, right? There's legal components. You don't just hire doctors and so on. There's a legal complexity. There's also, at the end of the day, like your top priority is patient care and quality of care. It is absolutely not making money. And so it's a very different beast to build good businesses in healthcare. And then you've got all the complex dynamics of how in the world do you get paid, right? We started out with building more direct consumer businesses because it's more straightforward. I did that with Everbody and Calibrate at Redesign. But then you realize that most people actually, they expect insurance to pay for care. And so the real opportunity and the real place where you can make a big difference is more in the reimbursement space and in the payer space. And so kind of inched my way towards more and more of that payer world. And MedArrive, the company that I had started, so I was working on various ideas for companies at Redesign after launching Everbody and Calibrate, and fell in love with this concept of MedArrive. It was early COVID. I was deathly worried about my family and my grandparents and how they were going to get the care that they needed, and saw this opportunity of bring care into the home, but do it cost effectively. It's really expensive to do it. So send not traditional providers like nurses and physicians, send paramedics. They're already going into some of the riskiest, scariest situations out there. Going to your grandma's house is quite palatable. And also from a scale perspective, really, really effective. So fell in love with that concept and launched it out of Redesign. Redesign was our initial investor, brought on others. And that was really my first foray into the payer space, because at this point, when you're dealing with, Medicare patients, Medicaid patients, you have to be thinking about getting reimbursed by payers. And so there, the complexity obviously grows, and so on. And really through that fell in love with both the complexity of that world, but also direct care delivery. Not the surrounding stuff, not the software, just bringing care directly to patients.
How did this lead you to where you are today, right? Because I think this is now your second healthcare startup. What is it like? Once a point, two's a trend. So, I tell us a little bit about what you're doing today.
Yeah, all my former business stats professors just need to cover their ears. Two points is a trend, right? But yes, so I was with MedArrive as the COO and co-founder for about 4.5 years. Absolutely, had the time of my life building this incredible platform. We focus primarily on Medicaid populations, so talk about the sickest of the sick, the folks who really need this kind of care. And around 2024, got introduced to the Abundant team, who were thinking about launching my current company. And at the time, MedArrive was starting to pivot more towards software, which makes a ton of sense for the business. For me and my love for care delivery, and I often refer to it as a bit of masochism because it's hard to make work, but I love it. I wanted to stick in care delivery, and so started talking to the Abundant folks and got really excited about this thing that they were building because it just made so much sense within healthcare. By this point in my career, I'd seen a lot of amazing things and also, to some extent, a lot of nonsense out in the space, as people were just throwing hordes and hordes of money at health tech and so on. And this thing just makes so much sense. So basically what we do at Auxira, my current company, is we provide care extension for busy cardiology practices. As you know, 10,000 Americans age into Medicare every single day. They all have multiple chronic conditions. A lot of those conditions, or not all, a majority have multiple chronic conditions. A majority of those tend to be in the cardiac space. The number of doctors is not really changing. There's something like a 500 cardiologist shortage created every single year. So how do you deal with that capacity constraint? And then on top of that, you've got doctors who are overwhelmed with the administrative burden of messages and inbox messaging with their patients. HRs are amazing. They've created an enormous amount of access for patients to connect directly with their physicians and so on, but they've also created a really meaningful administrative burden for the providers, who end up spending hours and hours in their EHR after hours answering messages and reviewing results and so on. So we address those two things as a virtual extension of practices. So our team staffs APPs to partner up with cardiologists. They build a really strong relationship. It's the same APP to just 3 physicians. So there's a really tight loop there and a lot of trust. And they take on lower acuity visits for those physicians so that the physicians have time to see the patients that really need to be seen in the office, the highest acuity, the new patients, et cetera. We take on the lower acuity follow-up care, thereby expanding the panel size altogether. And then we also spend a good bit of our day optimizing and managing their inbox so that at the end of the day, doctors and providers can go home, hang out with their kids, see their kids' soccer games, not spend hours in pajamas answering portal messages.
That is great. And I think when I heard about this idea for the first time, what really struck me is that, for one, right, it's we're trying to run a fairly similar model at Third Way, right? Kind of being that extension of a clinic, but really more focused on the front office. And I think it just shows that, really the possibility when you can rethink what should happen within the 4 walls of a clinic and what doesn't. Just to confirm, in this current day and age, these are real people, right? This is not, or is this AI? Where's AI in this? I haven't heard. Oops, the AI clocker was running and I didn't hear anything, so I just thought I'd clarify.
I'm so off trend, not mentioning AI, and you're the second person to bring it up to me today, actually, in a conversation, in an interview. Yeah. So here's the thing. We integrate directly into the EHRs and the systems of our clients. And what that does is it enables us to deliver really exceptional continuity of care and feel very, very native to our partners. So from a patient's perspective, like we're working with MedStar today, from a patient's perspective, we are a MedStar provider, but providing care virtually and so on. And we would have a much harder time doing that if we had our own fancy separate technology. That's point 1. Point 2 is AI and healthcare. There's an enormous amount of promise with AI and healthcare. And I think specifically if it's a pointed solution around decision support, operational optimization, things like that. But when it comes to actually interacting with the patient and treating the patient, nothing is going to replace the human interaction. Maybe 100 years from now, when we all have, robot AI overlords, we'll be in a very different world, but that's not the world we're in today. And today, what providers value most is time with their patients and time to give their patients really high quality care. And when you're talking about expanding capacity and expanding their panel size, I cannot add more minutes to the day for patient visits, but what I can do is provide really high quality, exceptional human talent and human providers to engage with the patients directly and provide that capacity expansion. So yes, bucking the trend here by providing really high quality human care and through really high quality operational excellence, optimizing the efficiency.
I think we're very kindred spirits in that, and I think it sometimes gets lost a little bit that, at the end of the day, AI is a enabler of care, right? An enabler of people, and that applies differently in different situations. And I think it's fantastic, right? Like it's building with the solution in mind, as opposed to, I think, certainly a lot of the conversation is building with AI and then trying to retroactively fit a use case. So some of the questions, and I'm very fascinated on your perspective on this, that we end up talking about, right, is traditional medical practices. I've talked to folks that have completely stood up a 100-year-old group in a new infrastructure. Have scaled a group 100 times the size now, and you are in an organization where in your last 2 organizations you had remote sort of distributed teams, right? Like people were out into the field. Now by like default, and you are at least semi distributed. And I'm curious, just from your lessons learned, about how you see operating models that have evolved in organizations. And when I say operating models, typically what we refer to is, how do people communicate? How do they make decisions? How does the organization as a whole, as an entity, evolve as a living, breathing thing, specifically given the type of how the organizations that you've been in a part of. So curious for some perspectives on that point from your experience.
Yeah. I founded a healthcare company at the start of COVID, right when I think COVID basically dropped this giant bomb on how organizations are, engage and interact and so on. And everybody and their mom went to work remotely and was in the basement communicating over Slack, email, and so on. With the exception, I would like to call out, of the incredible healthcare providers who were on the front lines and never got to go home and work from the comfort of their couch. And so, at that moment, it was like, great, like we can do just about everything with a distributed team, fully remote and so on, and run organizations. And I think that's proved out to be fairly true for a lot of organizations. And I think COVID was really powerful in changing minds around what's possible. That being said, I think what I've noticed is a kind of coalescing within certain industries and certain spaces of people being really selective of what makes sense remotely and what makes sense in person. So I'll give you an example. In our world at Auxira, again, you've got what we support are in-person cardiology clinics, right? So they've got fixed real estate. They they tell us, right? Like, we quite literally don't have the space to add another nurse practitioner into this ecosystem. Where would we put them? Where would the patients sit? And so on, without making another enormous investment in real estate, fixed costs, and so on. So how do we incorporate telemedicine efficiently? So for us, our APPs are remote, but because we have this super tight-knit integrated model with the clinics, it works. And it works partially because I send our APPs to train in person with the doctors for the first 4 to 6 weeks, which is kind of unheard of in the telemedicine world, right? In 2020, 2021, people would have said, great, we'll turn on a virtual APP for you tomorrow. But the issue with that is you haven't built the human connection, you haven't built the trust, you haven't built the reps of seeing how each provider practices in person. So it's that much more effective if you spend some time in person. So we're doing that. And then but then after the 4 to 6 weeks, our providers are fully remote, which obviously provides us with a ton of flexibility and so on. But then on the flip side, we do have a physical presence for our RN and our MA staff, because that's a place where we feel it's very, very important to have best-in-class operational efficiency and optimization. And that is really hard to achieve in a fully distributed world. It's different when you have an APP, a clinician seeing patients. That's that one-on-one engagement. But when you have somebody that needs to work really tightly with other people in a cross-functional team, because what we're doing is triaging care. This is done by the MA, this is done by the RN, this we send up to the APP, and so on. That works a lot better in person. And so we did the old school thing. We signed a lease. I haven't done that since like my early days at Redesign in 2019.
Well done.
And you guys do that too, I think, with your team.
Yeah, I think what I just hearing even you talk about your process, I think it's super interesting to hear the parallels, right? Because it fundamentally everything rests on training. I think we're big believers in that, and the turn it on tomorrow. It doesn't work even with technology, to be fair, but I think with people it matters even more. 80% of our people work on site, right? And I think what we've realized, again, per your point, a lot of the work that we do also is collaborative, right? And the value of someone tipping on each other on the shoulder, but also from the culture. I think you have people that want to be formed, that want to be part of this sort of greater environment, right? Like those are the things that my guess would be a seasoned provider is looking for different things than someone that might be younger in their career and a medical assistant. And so I think there's really wholeheartedly there's really interesting parallels. For us it's interesting because then we used to be 100% in office, and we kind of walked it back because at some point the people that are doing a really good job and they're super efficient, like then they like this flexibility, and we give it to people, sometimes some days a week, but we're never fully virtual.
Yeah. Same. Our MAs work from home 1 day a week, and
Yeah.
what clinic gives MAs the chance to work from home? Where do you get to room a patient from home?
How do you, but you're based in Colorado, right? And your office is in Maryland?
Maryland, yeah.
Maryland. So how do you think about communication, sort of decision making from your perspective in this, distributed model? What have you found to work particularly well?
You need really strong people. You need really strong leaders that you trust and you can delegate to. I have an absolutely incredible counterpart, Cindy Song, who's our senior director of implementation. She actually built this program at MedStar before we commercialized it and turned it into Auxira, and she jumped over to Auxira. She's on site a lot of the time in Columbia, Maryland, and she's also on the front lines of our implementations with physicians and so on. So I wouldn't be able to do that. Or if I were doing it myself, I would simply be living out on the East Coast. And I've got a family here in Boulder, so Cindy and I divide and conquer. But also, FaceTime is important. Every single time we hire a nurse practitioner, I fly out to the East Coast and I meet with them every single time, because it's that culture building is so important, especially at these early stages. I try to be on site with our physicians as much as humanly possible.
Wow, yes. Nothing beats the power of a good old in-person interaction. And I just had this moment. We were at America's Physician Groups conference out in San Diego, and we had a lot of our clients there, and you just end up having different conversations, right? And I think you just need to do that a little bit, and the return is like gigantic. To be fair, and sorry to APG, I did not attend a single session, but I ran into lots of people, and it was great. And it's just totally different doing that in person, and
Yeah.
so it's probably why a lot of people go to conferences, because I was definitely not the only one not being in sessions and just outside talking to people.
There's something about Zoom or any virtual setting where you end up talking about the topic of the meeting right away, which is great for efficiency. But it does have diminishing returns at some point where, it's sometimes important to talk about your kids and your bike trip over the
Yes,
weekend and build
yes.
a foundation on a human level and build that trust and then go from there.
I think what people need to come up with are better Zoom openers, right? Because the cold one typically is, oh, and where are you based?
I
And right? And so it's like, but you can only ask that once, realistically, maybe twice if you can, get away with it. I think people run out of Zoom conversation openers. So I'm curious, how do your clients think about outsourcing and what you hear on the ground and how that thinking has evolved? I think you said something really important earlier, which is COVID was a huge catalyst for this, because I think it showed that you can kind of unbundle the traditional medical practice and really not the more than half of the things probably don't need to happen in the practice themselves. We obviously deal with this all day long on the administrative side. How are you seeing that on the clinical side? Because there aren't really that many models in your vein that I've come across.
Yeah. And I think there's a reason that there haven't been many models, because we are touching the most precious, element of a provider's day, their patients. This is why they went to med school, right? It is to take care of patients. And so it's really hard to do well. But to your point, there's been a lot of evolution around how organizations think about outsourcing. And across the board, administrative or clinical, I think number one priority is quality, right? So if you can demonstrate that you can deliver the same and or ideally better quality with your outsourced service and product, that's like, then your foot's in the door, because that's just like, that's the bar to just get into the room. And then on top of that, of course, it's, are you cost effective? Are you potentially driving more revenue than they would on their own? And then the nuance becomes, okay, but what's the experience on the other side if we outsource it? Because you and I have we've all encountered various organizations, and they don't always have to be within healthcare, where you get like ping pong between areas and you're like, well, I'm clearly not talking to the original company here. This is a third party, and this this feels awful. You guys have no idea. Why am I re-explaining my story a fifth time and so on? Nobody wants that, especially for their patients. So that's a critical component of like, can you integrate in a really streamlined way so that it feels native? And that's something that we've invested a ton of effort to. And one of the reasons we work natively in our clients' EHRs. And then is there that trust? Like, do they trust you with their most precious resource and their most precious, the element of their careers, right? Their patients. And that's where I think a lot of organizations fall flat, because they tend to just throw bodies at the problem versus people who are aligned from a philosophical perspective with the clients. So that's kind of what I've seen. And once you can get over those hurdles and show that you can achieve that native sense, then organizations will do it, I think, all day long. Like, one of the highest compliments we got from MedStar was, it feels like us. That means we feel like we're a part of them. So that's been really powerful.
So what, without giving away too much of your secret sauce, what have you seen work particularly well, right? And like, you are the vendor, right? In terms of actually standing out from an approach and integrating. And I think it's almost on two levels. It's operationally, how do you integrate? And then there's probably also on the business side, how do you become a thought partner, right? Because you and your team, there's a difference between your providers and your MAs and your RNs doing the great work, and then also kind of changing hearts and minds, right? And like communicating that value and becoming a thought partner who ultimately probably ideally even sees things that the original client doesn't. So curious what you've seen work particularly well that you can share here.
Yeah. But I think first framing it as, because, any client's first reaction will often be, oh, but I can do this myself, right? Why would I engage you? And like, maybe sometimes they can, and often they can, but the challenge is, like, you and I, we wake up every day thinking about just this one thing, just this portion of the workflow, and we obsess over making it exceptionally high quality and smooth and delighting our clients and delivering exceptional care. Whereas when you build something within a larger organization, naturally, right, your focus is dispersed, and it's that much harder to just have that laser focus on driving as much value out of this portion as possible. So the thing that we try to convey is, you're hiring experts at this thing. You're hiring experts at creating a virtual extension of your practice and enabling everybody inside your ecosystem to focus on what they do best, which is the face-to-face patient care that you deliver on a daily basis. So that's been one aspect. And then the second, in terms of standing out, has really been around building trust. So for instance, in our case, we have a very high bar for the folks that we hire. It takes us longer to hire sometimes, even though we've got plenty of candidates. And then most importantly, we actually pull the providers into that final step of hiring. Nobody gets hired unless the physicians that are going to be paired up with that APP have met with the APP, have said yes to the APP, and the APP has said, yes, I want to work with this. So it's a mutual opt-in. So, certainly slows things down a little bit, but it creates this enormous buy-in, because it's like, oh, wow, like, this isn't just,
It creates accountability too, right? Because someone ultimately, and it is so interesting, because we try to do a version of the same, have our clients sort of sign off and ultimately say, yes, this person is like up to my stuff. Because even mentally, the challenge with outsourcing always is, well, it's this person, right? It's like the other person versus I hired this person, right? And like, that
Yeah.
sounds like a small difference, but I think I can totally see that playing a big difference in reality.
Yeah, and I hadn't thought about it in that framing of, like, I had a role, I had agency in hiring this person, therefore they're on my team.
Super interesting. And I'm curious, what else you have. I think one thing I just want to comment on is this component of trust, that
Mm-hmm.
at the end of the day, that's been the biggest wake up for me maybe in the last year. I used to work in sales at the advisory board, and they have a fantastic sales training, and it was all about, challenger sale and be smart and thoughtful and push your clients to think differently and so on. And and they were all on the methodology because I was 25 trying to tell health system executives like how to run their business, right? So you obviously need to focus on the methodology. I think in this space that we're operating in, at the end of the day, you're selling trust, right? Like and that completely upends things, and that upends how you deliver because once people trust you, it's like that is currency that is hard won, right? Like and really, really, really valuable.
Yep, 100%. Yeah, I mean, it's why I will pay thousands of dollars to fly an APP to train across the country with our providers. It makes a world of difference.
Ah, that is fantastic. Lots to talk about, and I think this is such a cool model. Do you see models similar to this in other specialties coming up? And I'm curious, is this a delivery model where does it run into any barriers based on it working well in some specialties, but maybe not as well in others? Or do you think the general approach is actually pretty replicatable?
I think the general approach is pretty replicable. I mean, the factor here is busy providers, and unfortunately for all of us in our healthcare system, like providers are only getting busier and busier. And so I like to think of this as it's the right way to do telemedicine, right? There's been a lot of like spaghetti thrown at the wall since COVID of like how do you do telemedicine, and the AMLs and the teledocs of the world, right there, they're great. They do a lot of great urgent care, but they also end up setting up sometimes like a totally parallel ecosystem to the provider. Whereas the way that we do it, the way that we integrate is basically a seamless back and forth between us virtually and then send the patient back into the office for a procedure, send the patient back to see the physician for something more serious. This is the right way to do virtual care, and you can apply that to a variety of other specialties. Right now, I'm laser focused on cardiology, and I think there's a lot of opportunity and a lot of relief that we can bring to cardiologists. But I am excited about the potential to expand, as we mature.
Yeah, and I think what is interesting, just thinking about or hearing what you're saying, is that these are models that work regardless of reimbursement, right? Because I think at the end of the day, you increase overall volume. If a provider is seeing fee for service, they can, see more patients totally under their panel. And if they are in some sort of a value-based care arrangement, and like cardiology is obviously one of the space where this is coming to, you have a better relationship with the patient, right? And I think that is what is really cool about what you guys have built is this sort of it should, it's not just the environment has to change and healthcare has to become a better place in order for this to work. It works today, right? So I think that's super cool. Well, we could talk about this really long, but I'm always curious, so that we sort of have like maybe 5 or 6 more rapid fire questions here. Let's run through some of them. I'm curious what you've come up with. So, what's one of the greatest successes in solving a healthcare operations problem that you've had? Just one only, in the interest of time.
That's one. I mean, I think one of the greatest things is really around that in-person training. But I would say if I were to bucket that is the emphasis on in person in a world that is constantly pushing everybody to be remote, AI driven, distributed, and so on. Like when I told the board that I wanted to have an office in Maryland and have people on site in Maryland, right? That was a shock. It's like, wait, we thought this was a remote and virtual company. It's like, yes. And I promise you that that what I'm doing here is I have a hypothesis that we're going to be that much more effective at being partially in person and that much more efficient, at least in the early days. And I will measure the heck out of this. And if I'm wrong, I will pivot, but and it's panned out, and it's really, and we've seen so many dividends come out of that in-person interaction in our office. And then of course the investment that we make in sending the APPs out to the providers. So I think going against the grain when everybody's expecting you to be fully virtual.
That is a good one. How do you measure the impact of people being in the office? Like the positive dividends that it's paying?
So there's like the everyday, there's the anecdotal everyday interactions. Our office is in a larger medical office, and so there's just like ad hoc interactions and engagements that wouldn't happen otherwise. That's one. Second is the team culture building. Every time I visit, which is every couple weeks or so, I see an evolution in the vibe and the connectivity and just the texture of the team that I think we wouldn't have. And then we have a very real baseline. We're lucky in that we can compare this program to programs that MedStar had built earlier in the cardiology space. And so we're going to be comparing how are we doing relative to the original program built within MedStar. And so like it's rare that you have like a true A/B test, but we have the luxury of doing that.
That's very cool. All right, next, this is one of my favorite questions because I don't have a good answer to it myself. In 2 sentences or less, how do you describe your job to people outside of the industry? And you work in healthcare when you're like, oh, that is
Yeah.
a good question.
Don't use a single acronym. That's the problem within healthcare. Okay. Remember that time you had to wait 9 months to get in to see a specialist? I solve that and I make your doctors happier at the same time.
Nice, nice. Good one. It's like a description and an elevator pitch at the same time. So that's good. So you're, in your second company, and I'm sure you have your fair set of experiences that you bring into this as well. So as you are getting started, what are the main things you pay attention to in a broader sense, quarter by quarter or year over year, and sort of how you're tracking the progress of the business?
So more immediately, quarter over quarter, I would say culture, team culture, because that permeates into everything that you do. Customer satisfaction. You have to have an immediate pulse on how happy your customers are and be willing and ready to pivot as needed. And then, of course, growth and our operational efficiency. That's always on my mind, right? I've got to keep growing the company and not run out of money, right? That's the job.
That sums it up nicely.
Yeah. And then like longer term, I think it's talent retention, right? Like nothing works if you're not
Hmm.
retaining the talent that you want to be retaining. Again, just like culture permeates into everything. And then you have to like again, long term strategically keep your eye on what is the actual value that we're driving? Are we actually delivering on the numbers that are on our slides? And is that value evolving over time?
Yeah, that's great. And the cool thing is, again, I feel like when you actually take over a chunk of doing the work, you are much more in control of that, right? And I think that's the difference of being the software vendor or whatever, right? Which is you get to do the work, and that has pros and cons, but I view it mostly as a pro because you are much more in control of those outcomes. Then you just got to track them. So for operators in healthcare, what's one thing everyone should pay attention to in the next year? I'm very curious what you're gonna say.
In the next year,
Yes.
that's very near term. Interesting. I would say provider well-being because I think we're not, it's improved since COVID. It hit a horrific low, but just because we're better than the low doesn't mean we're doing a great job.
We had a dinner with a few medical practice executives last week, and provider well-being was one of the top things that was on people's mind. You could guess what the other second one is, but that's the more obvious one that comes up in conversations. Ooh, this is a good one. What's your favorite healthcare statistic?
Well, I quoted it already. It's 10,000 Americans aging into Medicare daily.
Yes. Oh, or you had, what is it, 500 cardiologists short every year? That's a
Yeah,
uh
but that's also, to some extent a downstream of
yeah,
the
it's true.
and like that's going to change that's not just healthcare, that like demographically that changes the country and the world. So that's going to be interesting.
That is one way to describe it. All right. So last question. What does the week look like in the life of Ina, generally speaking? How do you structure your days and your weeks? What are sort of the general themes there?
I think one of the most fun and the hardest elements of being the CEO of an early stage company is you're context switching so dramatically, right? Like one moment I'm entering a credit card for some SaaS product that our company needs to buy, and another I'm pitching to investors and so on. But in a more meaningful way, one of the first things I do every day is I catch up with Cindy, our head of implementation. We try not to ever miss that catch up. If we have to move it, we do. But operational pulse on the business, really close to what's going on, and I try to be really hands on as much as possible with the team. So if I, like I said, I fly out there, I want to get to know all of our APPs. I want to get to know our team. I spend time with them. We have some new managers on the team. I spend time coaching them from a management perspective. It's just, those are like really important building blocks. And then of course there's the other elements of the job of, occasionally there's fundraising, and always there is meeting with new prospective clients and thinking about refining how we talk about the value that we drive and so on. And so some really fun context switching there.
Yeah, you are selling the business in more than one way, right? You're wearing multiple hats. The chief everything officer
I like that.
is yes, yes. I've heard that one thrown around.
It's an evolution from, what was it, Roman Roy in Succession? If it operates, I chief it as the CFO.
This was great. I had so much fun doing this. And pointer for just even people that you've known for a long time, you can learn something through structured discussions. So we'll leave that out to the world. But thank you so much for joining us. I mean, super exciting what you're doing. I think we're obviously big fans of you guys and excited to see where this will go. But
Likewise. So good to
awesome.
meet you, Fred.
All right. Bye-bye.
Bye.